Welcome to the WRAL Daily Download. I'm Ashley Rowe. Today, we're taking a broader look at a major story touching thousands of people in North Carolina. The ongoing back and forth between insurance companies and healthcare providers. The one in the headlines right now is UNC Health and Cigna because the two sides have not come to an agreement. Their contract expired this week. Here's a question we got from a viewer named Dixon. He wrote, "I don't want to be in the mess that Cigna customers are in. How can I find out when insurance companies' contracts with healthcare companies renew?" Dixon's right. This is really a mess for many of the 65,000 Cigna customers using UNC Health. We heard from a breast cancer survivor who had a scheduled hysterectomy. For a minute there, it sounded like it wasn't going to happen. But after jumping through a bunch of hoops, Cigna covered it, even after that contract expired. WRAL's Shaun Gallagher has been reporting on her story. I asked him about what she went through. Can you kind of walk me through just the anxiety and stress that this woman had trying to get coverage so that she could get this surgery without having to pay, $20,000?
Yeah, I mean, her anxiety was through the roof. I mean, this is like a life or death surgery for her. She needed to get something done to suppress her estrogen to try to prevent that breast cancer from coming back. She was getting, monthly injections, she told me, but that's not a long-term solution. The only solution would be to get this hysterectomy, which is a big decision for any woman to make, right? So, the fact that she was, between getting this incredibly valuable surgery to her or paying, $20,000 to do so, it just isn't fair to her. She had it booked for, over a year. And then to just find out a couple of weeks before that it wasn't going to be able to happen. I mean, she was, back against the wall trying to figure out what to do. That's why she contacted us to see if there was anything that could happen.
And so then she had to really advocate for herself to get that covered, right?
Yeah, that's right. She said, jumping through hoops is no hyperbole there. She reached out to us to see if there was anything that we could do to help her. And, she told me that when she was talking to people from Cigna, she said, "Hey, I'm going to the news with this because, nothing's being done." And she said today she got a call back that they were going to approve her eligibility for continuity of care. And they were going to be able to fit her in today. I haven't been able to speak with her in the last few hours, but the last I spoke to her, she was on her way back to the hospital to get this surgery done, and she was just elated. As you heard from my interview with Shaun, this woman had to fiercely advocate for herself to get her expensive surgery covered through something called continuity of care. But talk about a stressful situation for someone who should be focused on prepping her body for surgery and recovery. After the break, we get back to Dixon's question about how to avoid getting in the mess of insurance contract disputes. A WRAL News viewer wrote, "How can I find out when insurance companies' contracts with healthcare companies renew?" Right off the bat, let me say our major healthcare networks do list which insurance companies they contract with. We found these pages on the websites for WakeMed, Duke Health, and UNC Health. They tell you which insurance plans are accepted at their facilities, but they do not make it easy to find out when those contracts expire. Here's what we do know based on our reporting over the past few years. UNC Health reached a long-term deal with United Healthcare in March 2024. Duke Health reached a long-term deal with United a few months later. But right now, United is out of network for WakeMed. The two sides haven't reached a deal, and the contract expired last month. But WakeMed is all good with Cigna and Aetna for now. Those deals don't expire until the end of next year. UNC, Duke, and WakeMed all have deals with Blue Cross Blue Shield, and WakeMed's expires in 2027. It makes sense why these deals are difficult to make. Think about all of the healthcare news you've been seeing over the past few years. Inflation, increased labor costs, cuts to Medicaid, tariffs on supplies, the potential swell of uninsured patients if Affordable Care Act subsidies expire. I think it's safe to assume all of these things and more are taken into account in negotiations. But we aren't in the room for those conversations, so we have to be our own advocates. Think of the woman with breast cancer who almost missed her life-extending surgery, the woman who spoke with Shaun Gallagher. If it wasn't for her dogged efforts to get her surgery covered, threatening to take her story to the news, pushing to make sure the surgery fell under continuity of care, she may not have had that surgery at all. I'm Ashley Rowe. Thanks for joining us. And thanks for listening to the WRAL Daily Download and for making us part of your morning routine.
Another great way to get WRAL news is in the morning briefing newsletter. It's a daily email with triangle news, events, and headlines to help get you ready for the day. Sign up at WRAL.com/newsletter.